My name is Chanel Green. I am the regional recruiter for Select Medical's Outpatient Division. That includes NovaCare Rehabilitation, Select Physical Therapy, Kessler, Court, and just so many others. Select Medical includes hospitals, outpatient, and even occupational medicine facilities. The outpatient division spans 37 states with close to 1,800 outpatient centers. So for our outpatient division, we treat everyone from pediatrics through geriatrics. Recently, we've added additional pediatric services for the neuro and developmental pediatrics. So not just those playground accidents, but those having developmental delays. And those facilities are unique. They're dedicated pediatric facilities that add PT, OT, and speech services. So that was something new for me after being here for 14 years to learn about more of what we're doing in our community and responding to what the community needs. Of course, we have your athletes, your weekend warriors. Definitely one of the newer divisions is our Revital Care program. So that's our oncology division. Sports medicine, I think that's what we're most known for, but that's only about 30%, of our business. The rest is just pediatrics through geriatrics. I think when I think about our facilities and the therapists that are there, even our administrative assistants, which we call patient service specialists, each facility is unique. It's a standalone facility. So what makes that facility unique are the people inside. I'm stretching my brain to think of one that has 10, clinicians inside. If you're looking for those larger centers, we have them, but they're less of a commonality. With us. We absolutely have more of the smaller private practice feel than the larger, double-digit number, of clinicians treating patients. The majority of our therapists are physical therapists, but we also hire physical therapist assistants. We do have occupational therapists. We have certified occupational therapy assistants, CODAs. We also have speech-language pathologists. We have athletic trainers. There are some unique roles that we also have. Certified Strengthening Conditioning is CSCS certification. Those are fitness gurus, those that make sure that you are training right, you have the right form. We also have massage therapists. We have 300 CHTs on board with us, the largest number, or I guess the largest employer of hand therapists in the country, and a good 300 more plus that are working towards their CHT. We help them get there through courses and prep work. So when I mention that each facility is a little different, it's because we are responding to the needs of our community. So if we realize that our community does need a massage therapist, then that center is offering that service. We look at local leaders to be treating clinicians. So even if you decide as a new grad, okay, I just want to get my feet wet, all right, we have a mentorship program for you, or just support, just seasoned therapists there with you. You're never alone, as a new grad. The step before manager is patient care manager. And as a patient care manager, you start getting a little bit more about, program implementation, or start talking about budget, or, how to market and get those different referrals. So from a patient care manager to a center manager. A center manager, you're treating about 80% of the time, so still in patient care. But as you continue to grow and manage more centers, a center manager, I think they go up to about 3 to 5 centers, and then you start touching into a market manager, and then you hit regional director, and then you hit VP. So at VP, you're running entire states, but I can't think of not one VP that's not in patient care. Not to do a double negative, but all of our managers are still treating. We're not fast food therapy. These are our therapists that are making sure we do have that patient-centered focus. So their expectations of you are not beyond what they can do, because when you're out, they have to cover. So that brings it back to that team environment. With Select Medical, our medical plans include Blue Cross Blue Shield with 4 different PPO plans, a health savings account. Now the medical benefits are separate from the continuing education benefits, are separate from the 401k, which is a 25% match for up to the first 6%, and you're actually fully vested in 3 years. We do have, of course, short-term disability, long-term disability, life, and a lot of that is company paid. Of course, you can add, additional monies to that, but with our medical plan, with our continuing education, our 401k, our paid time off, That starts at the 32-hour mark. Most of the therapists I know work 40 hours, but we do have some, in certain areas that are at the 32, so that's full-time. For part-time or PRN, you do have the ability to participate into our continuing education courses. So those are available if you're working less than full-time. And if you're about 20 hours a week, you also have 401k options. So we do have some benefits for those that are not fully on board with us. But a lot of times I think people do want to be on full-time with us, but just can't, because of life. But at the same time, we have it available. Our continuing education program is nationwide unmatched, meaning there's no other company out there that can offer our clinicians the number of courses, the number of certifications. We have a mentorship program for our new grads, just helping them be a little bit more independent, after they get their license. We currently have residencies in orthopedics. We have residencies with sports. We have residencies with neuro and even pelvic health. The great thing about our residency programs is they continue to grow. We want to make sure we're doing them right. We want to make sure they are accredited. So right now we have, I want to say roughly like 15 to 20, but they're still growing. With our certifications that we offer, the certifications, we have study groups, for that. I mean, if we're paying for it, we want you to be as prepared as possible, for the certifications. But you don't have to go through ortho residency in order to get your OCS. We also have a study group that's online, and our passing average, I think we're about 80% passing average, so better than the national average for that, and still something that we continue to improve. So many people tell me about MedBridge courses and courses that are online. We do have them now in telehealth for sure because of COVID, but at the same time, the courses that I'm more familiar with are those over a weekend. They're yielding 10 to 13 contact hours, and they're taught locally by clinicians that work for us with these dedicated departments. These are people that are focused on their job, focused on continuing education, or focused on compliance, or focused on benefits. It's a great company. The stability and the size is something that I depend on. We look for those team players. We look for those people that want to be challenged. We look for those people that want to do more. So if it's teaching or doing community outreach, at your local high school or college, or even just at a health fair. We have a mobile PT van in some of our markets that it's just literally a PT on one of those long, thin, van types with, some treatment tables inside, so that somebody's complaining about, ACL, just to stretch them out. And while you're stretching, have that education, with them. So I think a lot of what we do in giving back is not just community outreach, but giving back to clinicians so that they can continue developing their skills. With Select Medical being our parent company, you can internally transfer across different divisions. You can internally transfer across different states because life changes, It has that big if in the middle of life, so it does happen often. Because when you're internally transferred, whether you're coming from the Select to the NovaCare or the California Rehab Institute to Kessler, you're going to maintain your benefits. You're going to maintain most likely seniority too. If we've trained you as a manager, we want to keep you using those skills and keeping you engaged. What I like about our company is that we do try our best to take care of our own. I know that managers and our regional directors and vice presidents, they will make a position for someone. If someone just finished their sports residency and they're looking for that position at UConn, then yeah, we'll talk with them and say, okay, this is what we can do. We're an outpatient, so these are people that are motivated, ready to get back to work or play or sports. So we really are looking for those positive energy, those positive individuals, those that enjoy working in a team, those that like to be challenged. I continue to say it because it truly is a part of us. Improving the quality of life or the power of physical therapy. Like these are our different mottos or taglines that we have for a reason. And there's so many instances, that support it. And we continue just to improve ourselves, and recognizing the changes, whether it's continuing education or whether it's a therapist who wants to start a lymphedema program. We're looking to respond to that need because obviously the community needs it.